At the beginning of our course, we were able to cover the basic structure of your bacteria and how the specific structure of your bacteria will influence the disease manifestation to the patient, and we call that one virulence factor. After covering that one, you were also able to cover the clinical part as pre-analytical stage with your clinical samples. What are the appropriate volume to collect the clinical sample to the correct anatomical site, and the correct culture media to use with the corresponding clinical samples. After the pre-analytical stage, we were able to discuss and jump off to your organisms. And we started with your Staphylococcus and Streptococci, which is your gram-positive bacteria. We're able to differentiate the two using a catalase test. That we know that some bacteria releases an enzyme and some does not release an enzyme. In the case of catalase, your Staphylococcus species releases the enzyme catalase that will differentiate them to your Streptococci. And we knew that the your Staphylococcus species includes your Staphylococcus aureus, Saprophyticus, and Epidermidis. And then your Streptococci includes your alpha, beta, and gamma based on your Burgess classification. Then you have your alpha, Streptococcus viridans, and you have your Streptococcus pneumoniae. For your beta, you have your Streptococcus agalactiae and Streptococcus pyogenes. And then your gamma includes your Enterococci and group D Enterococci. Then we jump off to your Enterobacteriaceae. For Enterobacteriaceae, we were able to discuss a lot of gastrointestinal bacteria that includes your E. coli, Klebsiella, Enterobacter. You have your Serratia, Proteus, then you have your Shigella, Salmonella, Yersinia, and a lot more. And we were able to identify that in order for us to specifically eliminate and find a specific culprit of that disease is by the use of your biochemical tests. And in your laboratory, you are able to discuss that one, the basic principles of biochemical tools to identify and speciate your Enterobacteriaceae. Moving on, we did proceed to your gram-negative fastidious organism that includes your Haemophilus, Vibrio, Legionella, and then you also have your Bordetella pertussis, Parapertussis, and then Pseudomonas aeruginosa, Burkholderia species, and etc. So, looking back, we did memorize a lot of bacteria. So, in this topic, we will try to cover the last part of our course, Clinical Bacteriology, which is your Mycoplasma, Chlamydia, and Rickettsia. So, good day. I am your professor for this topic. I am Alfredo Hinay Jr., RMD, MSPH, and I will basically cover on this video lecture the laboratory diagnosis of your spirochete infections and other unusual pathogens. And again, that includes your Mycoplasma, Chlamydia, and Rickettsia. So, let's go and cover the following organisms. So at the end of this lesson class video lecture, you, the students, first will be able to choose the appropriate test to diagnose the following diseases. You have your syphilis, Lyme disease, leptospirosis, you have your mycoplasma, chlamydia, and rickettsial diseases. And in connection with this one, of course, you need to, at the end of the video lecture, at least you can differentiate the species of your Treponema because you have a lot of species under your Treponema. That includes your Treponema pallidum, subspecies pallidum, pertinui, and others. You have your Borrelia, you have your Leptospira, Mycoplasma, Chlamydia, and Rickettsia based on their characteristics. And lastly, you will be able to identify the disease caused by these unusual pathogens. So as an overview, we'll discuss first the spirochetes. In the spirochetes class have three genera. You have your Borrelia, Leptospira, at saka Treponemal. So, in Treponemaceae, so meron siyang dalawa class that includes your Treponema at saka Borrelia. Tapos, Leptospirae naman class with your Leptospira. Okay? So, in order for us to differentiate the three genuses, we can use your acial filaments in our insertion list. Take note with this one class because in the past or previous board exam, they usually ask the number of insertion lists in or the acial filaments to differentiate your Treponema and your Borrelia. Because your Treponema and your Borrelia are on the same group and or are in the same family, then therefore we need to differentiate the two. So in order to differentiate the two class, your Treponema has insertion list of 1 compared with your Borrelia that has having insertion list of 2. In terms of acial filaments naman class, your Treponema pallidum, your Treponema species has lesser acial filaments compared with your Borrelia species. And also, I included here the acial filament insertion list for Leptospira for the preparation also of your quiz and or for your simulated board exam and board exam. Maybe by next year, next year when you take your board exam, they might not ask the difference between your Treponema over your Borrelia, but they will also include your Leptospira. So for the preparation, please memorize this one. And among the three, we will start first with your Treponema. So let's start with the description of your Treponema species. So your Treponema species are slender spirals. Okay, they are small, 0.1 to 0.5 micrometer. However, in length, they are 5 to 15 micrometer. So they are tightly coiled, and then you can observe that the morphology of your Treponema species are spirals. Okay, take note with the structure of other organisms that includes your cocci and you have your bacilli. In motility, they rotate steadily around their endoflagella. Okay, your endoflagella composed of your complex with the sheath and a core, even after attaching to cells by their tapered ends. Their outer membrane is composed of lipid with a cytoplasmic filaments. One good characteristic of Treponema species class is that they are not stained with your gum stain method. Though attempt can be performed, however, a poor result for your gum staining is expected. So, if we cannot use your gum staining as a tool to identify the Treponema species microscopic appearance, then we can use your immunofluorescent stain, dark field illumination, or iron staining are used and are recommended. Also, your Treponema species class are seen in tissue, then therefore, we can use your silver impregnation method. I believe that in your histopathology, you will cover the different stains of your tissue and you will encounter later the stains that we will mention on your Treponema species. Then let's jump off to the species level of your Treponema, which is your Treponema pallidum. And in this slide, we'll try to cover the antigenic structures of your organisms. First, you have your outer sheath. The outer sheath of your Treponema pallidum is somewhat thicker. This is due to the presence of your glycosaminoglycan coating. In addition, the outer membrane surrounds the periplasmic space and the peptidoglycan cytoplasmic membrane complex. This is the reason why class that it's too difficult to penetrate your primary stain of your gram stain, which is your crystal violet. Thus, your gram staining is not a good tool to identify your Treponema pallidum using microscopy. One major virulence factor of your Treponema pallidum class is your Endoflagella. Your Endoflagella, or also known as your acial filaments, is responsible for the motility of your organism. In addition, your Treponema pallidum also class releases an enzyme called your hyaluronidase, We discussed this one already with your streptococci. If you can still remember that your hyaluronidase is an enzyme also known as your spreading factor. Why? Because your hyaluronidase is an enzyme that will try to disrupt the basal function of your tissue. Your Treponemal pallidum also class contains greater than 100 protein antigens. Among the 100 protein antigens, we have your cardiolipin as one of the most common and most significant. We'll discuss this one when we will reach the serologic part of our discussion. And in connection, in the presence of your cardiolipin antigen, our body will develop a reagent antibody or antibody-like substances. And also the cardiolipin reagent complex, we'll discuss that one in our serologic discussion. Moreover, your Treponema species are non-cultivable organism, then therefore, your Treponema species has never been cultured on artificial media. However, infected skin, testes, and eye of rabbits are experimentally used to cultivate your organism. And also, growth on your tissue culture is not routinely done but performed. However, the major disadvantage of this one is short period of time. Your Treponema species, they are microaerophiles, then therefore they require a oxygen concentration of 1 to 4%. They may also remain motile in 3 to 6 days at 25 degrees Celsius, and take note by this one, your Treponema species remain viable for at least 24 hours in whole blood or plasma stored at 4 degrees Celsius. So if in our microbiology exam, simulated board exam or board exam, if this question will not appear on your microbiology, it would possibly appear on your blood banking. So take note that your Treponema species is still viable at least 24 hours in our whole blood or plasma stored at 4 degrees Celsius. Additionally, class your Treponema, denticola, Sokransky, Pectonovorum, okay, part of our normal flora, seen in e oral infection. And also your Treponema vincenti or Vincent spirillum is associated with ulceromembranous gingivitis or pharyngitis or Vincent's angina. For disease association, your Treponema pallidum, specifically class your Treponema pallidum subspecies pallidum, is associated with your syphilis. Take note, class, that your Treponema pallidum subspecies pallidum is sexually acquired infection. Also, the incubation period of this organism is around 3 to 6 weeks. For the infectious lesions class, you can observe the lesions on skin or mucous membrane of your genitalia. Other part of that one includes your intrarectal, perianal or oral, around 10 to 20% cases. Your Treponema pallidum subspecies pallidum, specifically your syphilis, can go multi-system, in that includes nearby lymph nodes, then reach to the bloodstream. So for your syphilis, we have 4 stages and we will discuss that one each. Then let's discuss the stages of Ferciphilis, which is caused by Treponema pallidum subspecies pallidum. The first stage is the presence of your dry, okay, non-tender lesion, also known as your hard chancre or Hunterian chancre at the site of funiculation. So if you can observe in the male part, so the hard chancre is usually located on the head part and then or to the neck part of the penis. Okay, the reason why the organism Treponema pallidum usually uh, have the first stage on this part is due to the moisture, specifically on the neck part of the penis. On the female part, usually they produce the hard chancre on the lip part of the vagina. After the development of your hard chunker class, okay, the hard chunker will become a dry lesion. And we call that one condyloma talata or condyloma. Okay, this is also found not only restricted to the genital area but can also found on other part of your body, and that includes your fingers. For example, I don't know how did the parasite went to that area class. However, it shows that the condyloma talata can spread to other body parts. And then if you can observe on the condyloma talata or condyloma, the dry lesions usually occur on the site of inoculation. So if the practice or sexual practice is anal, then the condyloma talata can be observed on the anal part. So this one is in the uh, anus of the female, and this one is the vagina. Then the latent stage, later we will observe that one. And then for the latent stage, so you have no symptoms but found specific anti-treponemal antibodies. Okay, and then untreated infection remain latent. So in this stage class, no symptoms, but if you will try to test with your specific anti-treponemal antibodies, which is your confirmatory test, it will become positive. And then if left untreated, your latent stage will proceed to your tertiary stage. And the general characteristic of your tertiary stage is your gommas, okay, which is usually found on skin, internal organs, including your CNS, bones, eyes, and your heart. So for CNS, it will involve to your neurosyphilis and then leading to paralysis. And then with your eyes, leading to blindness. In your heart, leading to aortic damage or aneurysm. So the first stage should be diagnose as early as possible, so it will not lead to your tertiary stage. However, even in the Philippines, syphilis is a taboo. Therefore, they male or female patients, they don't usually consult if hindi sila makakarating on the second stage and or on the tertiary stage. Your Treponemal pallidum subspecies pallidum is capable of crossing the placenta, infecting the fetus, leading to congenital syphilis. The congenital syphilis occurs under your latent stage of Ferciphilis in women where they don't have any symptoms. However, if tested with your surgical testing, it will turn positive. So, the congenital syphilis can lead to fetal death, okay, miscarriages, and or stillborn at term. The chance of the chance of surviving the child is high. However, the baby could have the following conditions. First, you have your interstitial keratitis, you have your Huntington's teeth, then you have your saddle nose, peritonitis, damage to mental development, or other neurological symptoms. So the characteristic of your Huntington's teeth looks like this one class, okay, in children. So we are done with your syphilis, which is caused by your Treponema pallidum subspecies pallidum. Then we will also include discussing the following other treponemal diseases. We have your Treponema pallidum subspecies pertinui, which can be transmitted through a traumatized skin, comes to contact with an infected person. So therefore, the mode of transmission of this organism is person to person and can lead to cause the disease YOS. So if you can observe on the YOS is a chronic infection disease caused by the bacterium Treponema pallidum subspecies pertinui, and it affects on the skin, bones, cartilage, and joints. That's the reason why the skin lesion usually occur on the elbow part where for example, cartilage and or joints are located. We also have your Treponema pallidum subspecies endemicum, okay, a mouth-to-mouth by utensils, and or by person-to-person contact as a mode of transmission. Your Treponemal pallidum subspecies endemicum can cause the endemic non-virial syphilis. So, I don't have a picture class with your Treponemal pallidum subspecies endemicum having the endemic non-virial syphilis, but the lesion usually occur on the mouth, and they usually describe that one as mouth lesion. And lastly, under your other treponemal diseases, you have your Treponema caricium. Your Treponema caricium is almost the same with your Treponema pallidum subspecies pertinui in terms of mode of transmission, where the traumatized skin comes in contact with a infected person. The disease association of your Treponema caricium is your pinta. Pinta is a lesion and or discoloration of your skin. So if you can observe in the picture, this is a hallmark characteristic of your pinta, which is the disease associated with your Treponema caricium. So for the preparation of your quiz exam and your simulated board exam, please don't forget to memorize the disease association of the following treponemal diseases. So you have your Treponemal pallidum subspecies pallidum for syphilis, Treponemal pallidum subspecies pertinui for Rios, Treponemal pallidum subspecies endemicum for endemic non-venereal syphilis, and you have your Treponema caricium for your pinta. Then let's move to your diagnostic laboratory test for your Treponema pallidum, subspecies pallidum. So to observe the microscopic appearance of your organism, as I mentioned earlier that gram staining is not a good tool to use, then we can use your dark field or phase contrast microscopy. So the dark field phase contrast microscopy is a microscopy where the background is black. So if you can observe your glass, the background is black and then the organism is white. And then they are called type spirals. So this is a hallmark characteristic of your Treponema pallidum subspecies pallidum. We can also use your immunofluorescence by the use of your fluorescein labeled anti-treponeme serum. And then since it's a immunofluorescence, we will use a dye. Then the dye will impart a color reaction to the organism due to the fluorescein label. And then it will produce a green colored treponemes. So you can observe the treponemes clearly here compared with your dark field or phase contrast microscopy. In the Philippines, we don't have these two, or if we have, only on the reference laboratory. So what we have in the hospitals is your serological test. And serological tests are divided into two. So you have your non-treponemal test and you have your treponemal antibody test. Then let's try to cover first your non-specific non-treponemal tests. They are called non-specific and non-treponemal tests because they are only for the screening purposes. Okay, and also for the efficacy of therapy. So for example, the patient is diagnosed already with syphilis. And then the doctor give the drug na already to the patient. And then after 7 days, the doctor wants to check if the drug is effective or not. So the medical laboratory scientist will perform a specific non-treponemal test for monitoring. Okay, then this one is for the efficacy of your therapy. So for your non-specific non-treponemal test, it uses a lipid antigen particles dispersed in a serum and flocculate with reagent. I believe that the uh, non-specific non-treponemal test is discussed already with your immunology and serology. And then you have your antigen. We discussed this one already in during your antigenic structure of your Treponema pallidum. You have your cardiolipin, and then your cardiolipin is part of the reagent of your test, together with your cholesterol and your purified lecithin. And then your cardiolipin is the reagent, And if the patient serum contains a reagent or a Wassermann antibodies, which is a non-treponemal antibodies, then it will produce a flocculation. Then the flocculation result looks like this one. So you have your cardiolipin in non-treponemal antigen plus the antibody from the serum of the patient, which is your reagent. Then you will produce the antigen-antibody reaction that is observable as your flocculation. So this one is your RPR. So test examples of your non-specific non-treponemal test includes your rapid plasma reagent, okay, your RPR card test, which uses your cardiolipin. This test is not usually performed with your CSF. If you have your CSF, then therefore we will proceed to your specific test. Then you also have your Venereal Disease Research Laboratory VDRL test, and also your unheated serum reagent or USR test, and toluidine red unheated serum test or TRUST. So these are the following non-specific non-treponemal tests. Among the four, the most common non-treponemal test that is used in the laboratory is your VDRL and your RPR. Then let's move to your specific treponemal test. Okay, the function of the specific treponemal test will serve as a confirmatory positive non-treponemal results. So you have the following tests. So first, you have your treponema pallidum particle agglutination or TPPA. Okay, a gelatin particle sensitized with your treponema pallidum. So the positive result of our treponema pallidum is agglutination. So if you can observe your class, this one is this one is a positive of your agglutination kasi nag-clamp na siya. Then this one is a negative result of your agglutination kasi dispersed pa rin siya. Okay? So if you have this positive result, then therefore the patient is positive with Treponema pallidum, subspecies pallidum. Then you have your Treponema pallidum heme agglutination or TPHA. Okay, although it's not on the picture, but it's the same principle of your particle agglutination, but the use of your blood. Next, you have your MHATP or microhemagglutination T pallidum, and then this test uses your sheep erythrocytes. Next, you have your enzyme immunoassay or EA for your T pallidum with your conventional EA. Okay, I believe that the principle of your EA is discussed already with your serology, but your application of your EA can be applied to your treponemal test. And lastly, you have your fluorescent treponemal antibody absorb or FTA-ABS class. Okay, with the use of your FTA-ABS, since fluorescent treponemal antibody siya, it can produce a color green reaction, okay, of your treponems, and then you can observe that one using your dark field microscope. And that's it for the specific treponemal test for your treponema pallidum subspecies pallidum. Again, I would like to highlight that the function of your screening test or non-treponemal test is for screening first, and second is for the efficacy of the treatment. Then your specific treponemal test is used for confirmatory tests. Then let's move to treatment. So the physician usually give the following treatment. First, you have your benzyl penicillin. You have your procaine penicillin. Okay, either primary or secondary syphilis, the physician usually add this one. And then if allergic, we can use your erythromycin, tetracycline, or chloramphenicol. Additional notes also, class, that your Treponema pallidum subspecies pallidum can be killed using e-drying or desiccation. Also, detergents can kill your spirochetes. and elevation of the temperature to 42 degrees Celsius because your Treponema species or your spirochetes are sensitive to heat. And then trivalent, arsenical, mercury, at saka bismuth. As we all know that metals are effective against your spirochetes. So we are done with your Treponema, and we were able to discuss and cover your Treponema pallidum subspecies pallidum, which is the causative agent of your syphilis. We're also able to cover the other treponemal diseases, and that includes your Treponema pallidum subspecies pertinui, which is the causative agent of Virus. Your Treponema pallidum subspecies endemicum, which is the causative agent of your endemic non-verinal syphilis. And lastly, you were able to cover your Treponema carisum, which is the causative agent of your pinta. Lastly, we also cover your serological test to identify and confirm your Treponema pallidum species. Okay, specifically on the disease of your syphilis. So now we will proceed to the next member of your Treponema CA, which is your Borrelia species. Your Borrelia species are associated with two principal human diseases. So first, you have relapsing fever. Although this disease is associated with different species of your Borrelia, however, your Borrelia recurrentis is the most linked as a causative agent of relapsing fever. Next, you have your Lyme disease or Lyme borreliosis, a multi-system infection caused by your Borrelia burgdorferi sensu lato. Okay, but other reference book naman class, they usually refer it as your Borrelia burgdorferi lang alone. They are helical rods around 8 to 30 micrometer in long and 0.2 to 0.5 micrometer in diameter. Now, one of the antigenic virulence factor of your Borrelia includes your flagellum, binding outer surface proteins, and genetic differences are used to differentiate your Borrelia species. So let's start with your Borrelia recurrentis. Your Borrelia recurrentis class is E vector-borne bacteria. So therefore, it requires E vector for them to be transferred to humans. So you have your Pediculus humanus as E vector of your Borrelia recurrentis. You need to memorize this one class for the preparation of your quiz, exam, simulated board exam, and board exam. In morphology and staining characteristic, the wet preparation of your peripheral blood is usually used. So the mix with equal part of your sterile, non-bacteriostatic saline under your dark or bright field illumination in which the spirochetes move rapidly, often pushing the red blood cells around. So the staining of your thick and thin films with your right or jab sustain using the procedure similar to those used to detect your malaria. Okay, so I believe that in your hematology, you discussed already the procedures of your jab sustain for your thick and thin. Then, therefore, the same procedure is applied for your Borrelia recurrentis identification. So, this is the uh, picture of your Pediculus humanus, and then they usually found on the head of the person infected. Borrelia recurrentis is the causative agent of a relapsing fever. It is characterized by fever, rigors, headaches, myalgia or body pain, arthralgia, photophobia, cough, and also your skin rash. In fatal cases, it will involve in your CNS, spleen, liver, and other organs, and may lead to hemorrhagic lesions, including your kidneys and your gastrointestinal tract. So, the ultimate recovery of your lapsing fever is after 3 to 10 relapses. So, it will take time, thus leading to fatal cases and involving the CNS to death. So the clearance of your Borrelia recurrentis is through the antibody-mediated killing of your spirochetes. So if you're immunocompromised, then your antibody is not working well, then it can cause and lead to fatal cases, then leading to death. Aside from your Borrelia recurrentis, as I mentioned earlier, that other Borrelia species can cause your relapsing fever, and that includes your Borrelia dotoni, Hermsii, Parkeri, Toricartii, and also you have your Borrelia Miyamoto. Then let's discuss the laboratory tools to identify your Borrelia recurrentis. So the definitive test for your epidemic relapsing fever is direct observation of your blood specimens of febrile patient with your spirochetemia. So spirochetemia, it means that the Borrelia recurrentis is present on the blood. So if you can observe on this mirror, this one is a uh, structure of your Borrelia recurrentis. Also, you can use your dark field wet prep, okay, because your Borrelia recurrentis move rapidly, okay, pushing your red blood cells. The thick and thin smear, as I mentioned earlier, can be used utilizing your right or Jamsa stains or acridine orange. The serological test is not reliable because of the antigenic shift. We will discuss thoroughly antigenic shift when we will proceed to your mycology virology, because the best way to explain your antigenic shift is with your influenza. But for now, at least you will know that the antigen structure of your Borrelia recurrentis changes over time, thus your surgical test is not reliable. For treatment, we have your tetracyclines, chloramphenicol, and erythromycin, and penicillin. This is just good to know or nice to know class, because we're not physician. As for now, we need to at least focus on the laboratory tools to identify your bacteria. So we are done with your Borrelia recurrentis. Then we'll move to your Borrelia burgdorferi. So your Borrelia burgdorferi class is also a vector-borne organism. So the vector for your Borrelia class is your Exodus tick, specifically your black-legged tick or Exodus spacularis. So you need to memorize this one class, specifically the laboratory tools. Because if your sample is coming from a tissue section, then therefore we need to use your Wharton star silver stain. So if you can observe on the picture on the left side, your Wharton star silver stain have a yellow background and then a darker orange to red organism. If our sample is not coming from a tissue section but from a culture media, specifically your modified Kelly's medium colonies, then we can use your acridine orange. This is a board exam questions class, so please highlight this one. So for the culture, you have your modified Kelly's medium, BSK2, BSKH, and or Priac Morsi. So these are examples of your modified Kelly's medium. I would like to highlight class that the culture media should be incubated at 30 to 34 degrees Celsius for up to 12 weeks under microaerophilic conditions. So the disease association of your Borrelia burgdorferi sensu stricto class is your Lyme disease or Lyme arthritis. So your Burgdorferi sensu stricto is the sole cause of your Lyme disease in the USA, where Lyme arthritis is common complication of infection. So in Europe, the association of your Lyme disease is with your Borrelia Apzelli, and Borrelia garinii. And also, the Lyme disease caused by these two organisms is associated with chronic skin and neurological manifestations. The vector involved with your Borrelia, Apzelli, and Borrelia garneri includes your Exodus, Damini, Exoides pacificus, and Ricimus. Okay? So, the virulence factor of your Borrelia burgdorferi, since stricto, have the antigenic variation. However, we can use your serologic test, specifically your AIA or enzyme immunoassay, and you have your immunofluorescence assay, and confirmed by your immunoblood assay. For the treatment of the following, either you will get your Borrelia burgdorferi stricto or Apzelli or Garanii, they follow the same treatment line. So first you have your doxycycline, and also you have your amoxicillin for children or pregnant women, and also penicillin, macrolides, cephalosporins, and tetracycline. Additional characteristic of your Lyme disease class, I would like to highlight this one, that your Lyme disease also is characterized by 3 stages. First, it will produce your erythema migrans or EMs. If you can observe on the right side picture of the skin, that's the rash, okay, characterized by red ring-shaped skin lesion with a central clearing that first appear at the site of the tick bite. After developing your erythema migrans, it will develop and go inside the blood, and that includes your arthritis. But the most important features are neurological disorder and carditis. Followed by the 3rd stage, where it is characterized by chronic arthritis or acrodermatitis chronica atropicans or ACA, a diffuse skin rash. So as I mentioned earlier, class, that your Borrelia may be grown on a liquid medium. You have your Barbour, a Stonky Kelly, or BSK2 medium. But this is seldom used. So we are done discussing your Treponemal and your Borrelia. Then we will now proceed to your Leptospira. Your Leptospira is the causative agent of a potentially fatal disease called your leptospirosis or rat fever. So human infections occur after contact with urine of infected animals, that includes your rats, dogs, cattle, pigs, and horses, or urine contaminated with water, soil, and in plants. In the Philippines, your leptospira is very prevalent, specifically on a flood area in Luzon, Visayas, and also in Mindanao. The common symptoms of your leptospirosis includes your abrupt onset of fever, headache, and also chills. If left untreated, these symptoms and or this disease, leptospirosis, can lead to meningitis, respiratory problems, and also liver renal failure that may lead to death. Then let's move to your Wills disease. So Wills disease is the acute severe form of your leptospirosis caused by your Leptospira enterocancervar enterohemorrhagiae. This disease class causes the infected individual to become jaundiced, developing kidney failure, and bleed. And bleeding from the lungs associated with your leptospirosis is also known as your severe pulmonary hemorrhagic syndrome. So your leptospira, enterocancervar enterohemorrhagiae class are tightly coiled, around 6 to 20 micrometer in long, 0.1 micrometer in diameter, and they will form a hook. Okay, and they also contains E. many serophores. with your Leptospira interrogans. They are called interrogans class because in microscopy they usually form a question mark. Okay, that's the reason why they are named as interrogans. They are examined by dark field microscopy or thick smears with your gem stain and also with your silver deposition, fluorescent antibody methods, or electron microscopy. But your leptospira interrogans class, yung pinaka accurate and sensitive is by the use of your microscopic agglutination test. And also with your cerebar typing. So for the preparation of your simulated board exam, pag tinanong sa exam, with your leptospira interrogans, cerevar enterohemorrhagiae, and even with the other cerevars, the best method is your MAT or microscopic agglutination test. Your organism can also grow on a semi-solid media that includes reflectors or EMJH or Ehler-Hansen, Mac-Colo-Johnson, and Harris. Then you need to incubate that one in an aerobic condition in or microaerophilic condition at 28 to 30 degrees Celsius. Take note with the temperature class, it is lower compared with the general incubation of 34 degrees Celsius. They are slow-growing organisms, so the generation time of this bacteria is 20 hours, and then the growth on solid media can be observed after 3 to 4 weeks. So aside from your Leptospira, your Borrelia, and then you have your Treponemal, we also have other spirochetal disease, and that includes your Spirillum minor or Spirillum morsus moris, which is the causative agent of your rat bite fever. Take note, class, that your rat bite fever is also associated with your Streptobacillus monoiliformis. Okay, so the characteristic of your Spirillum minor includes a small rigid spiral, and they are also distributed worldwide. So from the disease itself, right, bite fever, then therefore the mode of transmission is bite of rat. Local lesion, regional gland swelling, and skin rashes, together with fever, is a general manifestation of symptoms of your rat bite fever. So we are done with your Spirochetes class. We started discussing your Treponemal species, then with your Borrelia species, then last under your Spirochetes is your uh, Leptospira, and also we include your Spirulomimus. Now we will discuss the other miscellaneous organism, but take note, class, that your Mycoplasma is not under your Spirochetes. This is a separate genera already. So your Mycoplasma class, or also known as a cell wall-free bacteria, they are under your order Mycoplasma thales and a family Mycoplasma tcea. Under this family class, we have two medically important genera, and that includes your Mycoplasma and Ureaplasma. And among these two genera class, we have four species of a primary importance. So you have your Mycoplasma pneumoniae, okay, that causes pneumonia or atypical pneumonia, then can also cause joint infection and other infections. You have your ureaplasma urolithecum, a non-gonococcal urethritis. It means that it can cause urethritis but the causative agent is not gonorrhea, kaya siya tinawag na non-gonococcal urethritis. We also have your Mycoplasma hominis, okay, can cause your postpartum fever, uterine tube infection, and you have your Mycoplasma genitalium, okay, that can cause urethral and other infections. So if you can observe, class, your atypical pneumonia is caused by your Mycoplasma pneumoniae, and also other organisms, class, that can cause respiratory infection includes your Mycobacterium tuberculosis that can cause your tuberculosis. Your Streptococcus pneumoniae can cause your community acquired pneumonia. Then you have your Legionella pneumophila. Okay, that can cause your uh, Legionnaire's disease. Ayan, class. Your Mycoplasma pneumoniae class is characterized by the absence of a peptidoglycan cell wall and resulting resistance to many antibacterial agents. Instead of having your peptidoglycan for your Mycoplasma pneumoniae, they have a unique high content of cholesterols that prevent the osmotic lysis. They're very small, around 125 to 250 nanometer. They are highly pleomorphic in nature and resistant to penicillin, as we all know that your penicillin will inhibit the penicillin binding protein, which is a component of your peptidoglycan. And as I mentioned earlier, that your mycoplasma does not have a peptidoglycan content, then therefore your penicillin is not effective against your mycoplasma. Virulence factor includes your protein P1, which is specific adhesin protein, and your cardstoxin. Moreover, class, you have your ureaplasma ureaticum and you have your ureaplasma parvum, which is the T-form mycoplasma. When we say T-form, class, it indicates E tiny colonies or T strains or tiny colonies. They have almost the same characteristic with your mycoplasma, but the colony are smaller than your mycoplasma pneumoniae. They are associated with your non-gonococcal urethritis, as I mentioned it earlier, which is characterized by burning on urination and with yellow mucky discharge from the urethra. Also, your ureaplasma ureaticum and parvum is associated with lung disease in premature low birth weight infants. For culture, characteristic of your mycoplasma, always remember, class, that the colonies is characterized by fried egg or mulberry appearance without peripheral zone. Okay, dome-shaped colonies around 2 to millimeter in diameter. So for the preparation of your exam, quiz, and or any SBE, simulated board exam, and board exam, usually, pag tinatanong nila sila mycoplasma pneumoniae, class, colony characteristic talaga yan. So, you have your fried egg appearance. For the culture characteristic naman, class, it will grow and produce a good colony around 2 to 3 weeks. However, that the organism is a fastidious organism, therefore, the culture should be supplemented with your cholesterol and nucleic acid, fatty acid, including your amino acids. Example of your culture media that we can use with your Mycoplasma pneumoniae is you have your bovine heart infusion with fresh yeast extract and horse serum. You have your SP4 medium anaerobic conditions. The atmospheric condition for this culture media requires 95% nitrogen and 5% carbon. Then the optimum temperature is 36 degrees Celsius. If culture is too difficult in the laboratory, we can use your serology to identify your Mycoplasma pneumoniae. So, best analyte to identify is your IgA, IgM, IgG ELISA of your Mycoplasma. If your laboratory is advanced, then we can use your molecular tests. And by the use of your new DNA probe, or either a nucleic acid hybridization or a QRT-PCR. For treatment of your mycoplasma, we can use your tetracycline, macrolides, and fluoroquinolones. Again, class, for your quiz and for your exam, for this one, there are no questions about treatment. The questions will be more on your colony characteristics and then your culture as well as the laboratory tools. So since your mycoplasma and other bacteria that I mentioned in this video lecture are not common in bacterial isolation, then therefore serological testing is needed. So you need to memorize that one for the preparation of your quiz and exam. Also, you have your Rickettsia, Orientia, Ehrlichia, Anaplasma, and Coxiella. Okay, these are miscellaneous bacteria already class. These five genus of your organism is under your Rickettsia. They are obligate intracellular parasites and very small, around 0.3 to 0.5 by 0.8 to 1 micrometer, gram-negative bacilli, and reside in the cytosol of the host cells. Your among the 5 class, we need also to take note that your Orienta, although they are a gram-negative bacilli, they don't have your LPS or lipopolysaccharide, which is very common component of your gram-negative bacilli. Also, they don't have your peptidoglycan similar to your mycoplasma, and also they don't have your slime layer. Slime layer is associated with your biofilm, which we discussed already with your Staphylococcus epidermidis. And also your Pseudomonas aeruginosa is able to produce your slime layer associated with your biofilm formation. The infection caused with these 5 genera includes your fever, rashes, and your vasculitis. They are all transmitted to human by arthropods through the bite or feces of an infected vector or inhalation of aerosols. So I prepare a table to differentiate your rickettsia and also other genuses under your rickettsia. So for the virulence factor of your rickettsia, okay, rickettsia class is a how do you call this one class? They are intracellular parasites, so therefore they require a host cell to replicate. So first, they will damage the endothelial cell lining of the blood vessels, and then they will induce phagocytosis. They will offer their own body class to the macrophages and neutrophil, engulf me, okay? Because they need to survive inside the cell class. Then recruitment of your actin for intracellular spread. So since we know that in our human anatomy that inside the cell, you have your actin filaments, and then the organism, Rickettsia class, will collect the actin and put that one to their body so they can move. It's the same with your AEC class of your AEC, you have hemorrhagic E. coli, EEC, invasive E. coli, that they are non-motile. However, they collect the actin filaments for movement. The same with your Shigella also. For spreading, they will also collect your actin filament to spread for infection. And since, of course, they recruit, uh, they allow themselves to be engulfed by your phagocytes, then therefore the organism also has a virulence factor that is resistant to lysosomal enzymes. So they can survive inside the cell. So this is a good table to differentiate your uh, diseases under your Rickettsia and Orienta species. So this is divided into 3 groups. So you have your spotted fever, typhus, and scab typhus. Under your spotted fever, you have your Rocky Mountain spotted fever as a disease, rickettsial pox, Inditic typhus, which is associated with your rickettsiae, acari, and conori, conorili. Coronii, sorry class. Conorii. Okay. So yeah, also have your typhus. You have your epidemic loss-borne typhus, which is the causative agent. Is your Rickettsia prowazekii. You have your Brill-Zinsser disease, uh, the same causative agent. And also you have your endemic marine flea-borne typhus. The causative agent is your Rickettsia typhi. And also, you have your scab typhus. Scab typhus is a disease. Then the organism causative agent is Orienta tsutsugamushi. Okay, take note with this one class because among all of the diseases, usually lumalabas si Orienta tsutsugamushi. Okay, also with your rickettsiae at saka Rickettsia typhi. Those are the most common Rickettsia species na lumalabas sa quiz exam, sa written bar exam, and board exam. Also, I provided a table for your Ehrlichia, Anaplasma, Neurochetia, and Coxella species, including the species of the organism, the disease associated, the distribution, and then the mode of transmission, as well as the primary vectors. For the preparation of your quiz, at least you need to highlight the following class. First, you have your Coxiella bornetii, which is very common. They are intracellular, cultivated in cell free medium, genetically related to your Legionella species. They are the causative agent of your Q fever. Aside kay Coxiella bornetii class, we need also to highlight your Ehrlichia caffensis. So your Ehrlichia caffensis, sorry class caffensis, your Ehrlichia caffensis class is the causative agent of your monocytic ehrlichiosis. So among the following diseases class, these are the two that is more common that we need to at least memorize for the preparation of your quiz and exam. For the recurrential diagnosis and serology, we can use a direct detection in tissue by the use of enzyme sustain or immunofluorescent tests. If your laboratory is well equipped, we can use your electron microscopy for the identification of this organism. For culture, we can use your cell culture in laboratory animals, either by the use of mice or guinea pig, and also impregnated chicken eggs. If you will use your culture class, we can detect the organism up to 48 to 72 hours after inoculation. And then after you inoculate class, we will use your cell vial assay, okay, a technique uh, that follows the same principle with your centrifugation. And then we can find your uh, rickettsial structure on your slide, and then we can stain and we can observe the bacteria. We will discuss more your cell vial assay when we will discuss your virology. And if you don't have this equipment, we can actually use your serology by the use of your immunofluorescence, and or even the most simplest one, you have your enzyme immunoassay. For recurrential disease class, we need to highlight that the serological test, including your Will-Felix reaction, is also included. Okay, your Will-Felix reaction is antibodies formed will agglutinate with your OX strain of your Proteus vulgaris and no longer recommended due to unacceptable or poor sensitivity and specificity. Therefore, we need to use your high caliber materials and or equipment, which is your PCR amplification. I hope that your Will-Felix reaction is well explained already with your serology. For the treatment and prevention of this bacteria class, include your doxycycline, chloramphenicol, and for the prevention, eradicate the lice, ticks, fleas, and mites that are the vectors of this organism. Also, wear protective clothing and use of insect repellent. And we are now down to the last bacteria that we will discuss on your bacteriology class, which is your Chlamydia. The reason why we usually put your Chlamydia or Chlamydia species on the last part of your clinical bacteriology is that your Chlamydia is actually classified before as virus. So the next part of your clinical bacteriology is virology and mycology. That's the reason why your Chlamydia will serve as a bridge to your virology, then to your mycology. Your Chlamydia or Chlamydiae are under the order Chlamydiales. Then we also have three medically important species. So you have your Chlamydia trachomatis, you have your Chlamydia pneumoniae, and then you have your Chlamydia cetaxi. Okay, so if you're watching your house MV, if you're free time, you were able to see also and witness the case of Alfredo, who had the infection caused by your Chlamydia psittaci. Your Chlamydia psittaci is associated with birds, parrots, and or any uh, related to your chicken. So they are obligate intracellular parasite. Therefore, they are classified before as viruses. However, when they try to check the genome characteristic of your chlamydia class, they found out that the chlamydia contains both DNA and RNA. Therefore, hindi sila pwedeng maklasify as virus because viruses, as we all know, hindi nyo pa pala alam class, na viruses class, hindi sila pwedeng magkaroon ng same with your DNA at saka RNA. Dapat pipili lang talaga ng isa yung viruses. So either RNA virus ka or DNA virus. So before, when they try to examine your chlamydia, then they found out na both of your DNA and RNA are present of this type of organism. Then kinik out nila si chlamydia from the virus. Then nilagay sila sa bacteria. Okay, the cell wall is similar to your gram-negative bacilli but lack of your peptidoglycan. And then the virulence factor includes your cytotoxin, type 3 secretory pathway, and protease. Okay, so now I will explain the life cycle of your chlamydia. So it will always start with your elementary bodies. So elementary bodies class are metabolically inactive. So they infect the host when the cell ingests them. So the ingestion of your cell to your elementary bodies is under the influence of a receptor mediated endocytosis. So once inside the cell, the elementary bodies differentiate into reticulate bodies, which are metabolically active but non-infectious. So the reticulate bodies, which rely on the host cell for adenosine triphosphate or ATP synthesis, they will divide by binary fission and induce a host immune response. After 48 to 72 hours, the reticulate bodies reorganize themselves and condense again to form a new elementary bodies. Then the elementary bodies then leave the whole cell and start a new infection cycle. So, yung key term that we need to memorize this one class is that your elementary bodies are metabolically inactive but infectious. Your reticulate bodies are metabolically active but non-infectious. So take note with the two. So for the disease association of your chlamydia includes, first you have your Chlamydia trachomatis, which is the causative agent for trachoma, okay, leading cause of your blindness in the world. So if you can observe on the picture, on the back of your eyelid, so you have your trachoma. Okay, you also your trachoma is associated with serotype AB, BA, and C. For the serotype D through K, uh, inclusion conjunctivitis naman, specifically with the newborn, contracted in the birth canal. Your serotype D through K is also associated with your ophthalmic neonatorium. You know this one already because we encountered the term during your gram-negative organism, which is your Neisseria gonorrhoeae. Okay, with the ophthalmic neonatorium, we know that the best treatment for this one is your erythromycin drop or Creed's prophylaxis. But Creed's prophylaxis uses your metals, silver, then therefore we need to use a more safer, which is your erythromycin. Your serotypes L1, L2, and L3 is associated with your lymphogranuloma venereum or LGV. So if you can see from the picture, your LGV will try to infect the uh, neck part, to body part of your pelvis. Also, you have your Chlamydia psittaxis, as I mentioned it earlier. It can cause atypical pneumonia. If you will watch the one episode of your House MD class, Alfredo is having a severe asthma, and then one of his part-time job is to collect dead chicken during the cockfight. Kaya nakuha niya yung Chlamydia psittaxis. You also have your chlamydia, pneumonia, atypical pneumonia, bronchitis, pharyngitis, and sinusitis. For the treatment, the best treatment for this one, for adult, you have your doxycycline, and also you have your erythromycin and azithromycin. For the diagnostics of your chlamydia class, we can centrifuge the sample and then grow it on your McCoy cells, a cyclohexamide treated cell line, and then stain with your fluorescent monoclonal antibody. Then we can identify or detect the inclusions. So your chlamydia pneumoniae and your chlamydia cetaxi class are resistant to your sulfonamides. Also, your chlamydia trachomatis are glycogen-rich intracytoplasmic inclusion stained with your iodine on your McCoy cells. So if you can observe this one class, this one is your uh, inclusions, because the Chlamydia trachomatis contains a glycogen-rich intracytoplasmic inclusion. So we can use the stained iodine. Yeah. So this one also is a good example. In serology, we can use your complement fixation and immunofluorescent tests. And then elevated titers is expected for chlamydia species. We can also use your ELISA and rapid POC tests. For molecular tests, we can use your nucleic acid amplification test or NAAT, or NAT as uh, the same with your PCR. So we are done with your last topic of your clinical bacteriology. So thank you for bearing the entire semester and discussing different bacteria and their virulence factor in disease association, specifically with the laboratory diagnosis. As a last lecture of your clinical bacteriology, I would like to remind you that you have a 20% board exam preparation. In the 20% of the board exam, the 100 questions there, 70% will be coming from your bacteriology, and then 30% will be coming from your parasitology. And the 70% na tanong dun class, 8 questions will be coming from your mycology and virology. Will you gonna take that one naman after the semester? So therefore, you need to learn your bacteriology by heart because this is a professional subject. Thank you for listening and have a great day.